Hi everyone, my name is Andrew Beard, and I will be speaking today about Medicaid expansion. um, Medicaid is a very complex and multifaceted insurance policy that is somewhat polarizing in our country. There's multiple parties who either agree or disagree with Medicaid and the level in which it's expanded. So it can be pretty difficult to find unbiased information regarding Medicaid. But what I'm going to be talking to you about today is the Medicaid expansion that happened under President Obama. I'm going to be giving you some basic definitions of what Medicaid is, what the expansion means, and some of the politics that surrounded that, and some of the subsequent things that happened after the Affordable Care Act happened and Medicaid expansion. And then I'll be talking about two different states, one that opted in to Medicaid expansion, Colorado, which is where I live, and then Florida, who did not, and just some of the differences there. And then finally, I'll wrap it up with some other resources and things that you all can look at to further your knowledge and understanding of this complex subject. So Medicaid, what is it? Medicaid is a federal insurance that is offered to low-income families or persons. So an example of this would be someone who has been disabled maybe for less than a couple of years, hasn't been working, but still needs access to health care. What they would do is that they would go down to either the Department of Health and Human Services, a social worker, or somebody like that, and they would apply for Medicaid at their state level. Now, each individual state level has their own requirements of who can qualify for Medicaid and who doesn't, and that's based off of poverty guidelines for the state. So, for example, $70,000 in Colorado goes a lot further than it does in California. So somebody in California may have $100,000 and they may meet that same requirement for the poverty level, but then wouldn't meet it for Colorado. So then they apply for Medicaid, and then they're approved or denied, and then they have access to health care. So they have a Medicaid card, and they present that just similar as you would with a private insurance, and allows you to access care through primary care, urgent care, emergency department, and then also all the way up to the inpatient level. So the Affordable Care Act passed under President Obama, and under that, it was mandated that there was a nationwide expansion of Medicaid policies. And there was a lot of people who had a problem with that. And so as a result, the Supreme Court ruled in on this and said that states can mandate whether or not they opt into the Medicaid expansion. Now, up until now, all but 17 states have chosen to opt into Medicaid. So the vast majority have, but they opt in at different levels, at levels that are right for them as an individual state, as opposed to nationwide qualifications. So moving through, the average person that qualifies for Medicaid lives 130% below the poverty level, the national poverty level, and that's individualized based off of individual incomes or family incomes all the way up to families of 8 to 10, and it all has different calculations based off of the state. So states could change that to address what's called the coverage gap. The coverage gap are those patients, or those citizens rather, who otherwise who did not qualify for Medicaid because they made too much, they weren't at the 130% mark, and so they didn't qualify for Medicaid, but they made too much made too little to pay for private insurance. So they have this gap where these people are not going to be able to afford insurance either way, too low on the Medicaid side and too much on the private insurance side. So this Medicaid expansion addressed that by saying, okay, we change the way in which people qualify to lower that coverage gap and allow more people to access Medicaid. So now we're going to get into the portion of this presentation that I call "So What? Who Cares?" So what? Who cares? Why do I care as a student nurse practitioner who is just trying to get through this program and try to figure out how to see people? Well, why do I care about this? Well, you should care. Um, we as nurse practitioners, our whole job was to come into this to lower healthcare costs. So now we're looking at other ways that we can lower healthcare costs. And the way that we can do that is by providing people with insurance. So, for example, a homeless man walks into the emergency department and says, I need a refill of my beta blocker, of my statin drug. And by the way, I'm all out of my digoxin too. I'm started having chest pain a little bit, and I feel like I'm just kind of blowing up with fluid. So now he has this $6,000 ER workup. He's admitted to the hospital for a couple days. Or what we could do is we could provide this guy with insurance and say, okay, go to primary care. They give him his medications at little to no cost. He accesses care at little to no cost at the primary care level. And we as a healthcare system benefit. Taxpayers are not paying the higher costs of the emergency department visit, of the inpatient hospital admission. And individual providers at the primary care level are also being reimbursed for providing services to these people. So they're not providing these services for free. The government, granted, it's lower than private insurance, it's lower than Medicare, but they're still getting some benefit from this. And then they also get some sort of kickback at the end of this, that they provide a certain if a certain percentage of their patients also has Medicaid. They get a kickback from the federal government from that, because the federal government says, hey, you're saving us money by providing care to this tough patient population that really does need it. So we're going to give you a kickback on the tail end of this. So now moving through, we're going to be talking about Colorado first. Colorado was a state that did choose to expand Medicaid. So we had an uninsured rate of 15.8% in 2011, and that decreased after the Medicaid expansion to 6.5%. So nearly a 50 some odd percent decrease in patients that were uninsured. So the coverage gap that I was talking about before, the patients who could not afford private insurance but made too much for Medicaid, we decreased that in Colorado from 740,000 to about 340,000. So nearly 400,000 more citizens in Colorado had access to care as a result of this. And then actually, surprisingly enough, what the data that's the most interesting to me is that the individual in Colorado had an average of $453 more in their bank account during tax season, because the healthcare cost to Coloradans was actually less. So while the argument could be, oh man, we're paying more for these people to have insurance, it's actually saving us money. You have $453 more in your bank account if you live in Colorado as a result of the Medicaid expansion. So moving on to Florida, which has the second highest amount of citizens that do not have healthcare insurance, just behind Texas. They chose to not expand Medicaid. So there was an estimated 384,000 citizens that are in that coverage gap now in Medicaid that would have otherwise been covered if Medicaid had been expanded. So 384,000 citizens that cannot access care at a reasonable cost. It's pretty huge. That ties into $65.2 billion over the next decade as estimated for Florida to lose as a result of not increasing or expanding Medicaid services. Young adults and adults with dependents were only eligible at 29% below the federal poverty level, as opposed to the 130% that I told you guys before. And so those guys, which is a pretty big population, are most at risk. So further reading. If you guys want to do further reading on this, I would urge you to do so. There's a lot of partisan stuff out there, so I would try to stay away from the major news outlets. Look at the Kaiser Family Foundation. They have some great data on this. The Centers for Medicare and Medicaid Services is also possesses great data. And then also at the state level, if you type in your state government, say California, where the school is located, or Colorado, where I'm at, colorado.gov actually has individualized statistics, where I got the majority of my statistics for this, and they can help break it down a little further. So hey guys, I really appreciate your time and listening to this complex and multifaceted subject. I hope I described it well. Look forward to your comments and your feedback. Thank you so much.